Is this room 104? Perfect. I'll come in then and do a little checkup on you. Hello dear, my name is Jenny and I'll be your nurse today. I spoke with your doctor earlier and I hope I can help you any way I can. Oh, sweetie, what's wrong? Are you too cold? If you want, I can make a blanket for you with my silk. Are you afraid of me? Oh, my poor thing. I promise I won't hurt you, cutie. I want to help you. Oh, you poor sweetheart. You've been scared of spiders since you were young? Oh, I hope I can show you that you have nothing to fear from me. Alright, sweetie. I'll give you a little space to calm down. In the meantime, could I ask you some questions? They'll be simple and straightforward, okay? Thank you, sweetie. I promise to be quick. First question. Are you currently experiencing any discomfort, such as mild pain, fever, dizziness, or headache? Alright. Mild fever? A bit of a headache, and I can definitely see some injuries on your body. Do any of these injuries hurt? I see. Don't worry, dear. I can easily patch those up. I can use my silk as bandages and help patch you up and ease any discomfort. Yes, that does mean I have to come close to you, sweetie. But seeing that small blush you have, I think it'll work out just fine. Aww, that was a cute little pout. My. Are you starting to warm up to a little spider like me, darling? Looks like you are. Aw, you don't have to turn away, darling. I enjoy seeing that adorable blush you have for me. There's that cute smile. See, sweetie? All I want to do is take care of you. It's my job to get you back to your feet as soon as possible. Oh, you want to know how long I've worked here? Let's see. I started working as a nurse here about 50 years ago, so I have plenty of experience with helping patients, including adorable cuties like you. I don't look a day over 30. Oh, sweetie, you're too kind. I'm so glad you think I'm still in my youth, but no, darling, I'm actually 82. Although that doesn't mean I can't go out with a cute young human like you. Alright, cutie, let me take a look at those injuries. Don't worry, I won't bite. I'll only tell you how adorable you are. Alright, sweetie, tell me what's going on. Do you mind if I listen to your heart? I'll use my stethoscope for a second, okay? Thank you. Breathe in for me, sweetie. And breathe out. Very good, sweetheart. One more time. Breathe in. Breathe out. Well done, cutie. You have a normal heart rate and very soothing one at that. How are you holding up so far? Are you less scared of me, cutie? That's good. At least you're getting used to this sweet spider. It's so nice to see you starting to trust me, darling. Oh, that smile is so cute. Alright, sweetheart, I'll stop teasing you for now. But don't want you to blush up a storm while I work on patching you up. Even if it makes you the cutest thing in the world. Alright, cutie, take a deep breath for me. Try to relax and let go of all of your stress. That's it, you're doing so good for me. Just keep breathing deeply and relax. You're doing so well for me. Can I take your temperature now, cutie? Thank you, darling. Alright, cutie, say, Oh my, you're just over 103 degrees. A mild fever, so nothing too serious. Maybe you're just a little too hot from seeing a beautiful spider nurse taking care of you. Aww. And now you're getting even hotter and cuter. Oh, I'm sorry, sweetie. It's just a habit of mine to flirt with the adorable patients. It's an old and bad habit of mine, but I like to think it helps them feel a little bit more happy. Okay, it may be a little unethical, but still it brings more smiles on people's cute faces. Plus, who doesn't like a flirty nurse that takes care of them? Aw, that blush tells me everything, cutie. My. Looks like you want me to take you to my place or on a date, huh? Well, unfortunately, I'm not allowed to date my patients. Oh, but that doesn't mean we can't ever go out, sugar. Once you feel better and leave the hospital completely healthy, let's just say there's a wonderful restaurant 5 blocks left off here. Am I asking you out? Well, after you get better and no longer be my patient, then yes, I'm asking you out, cutie. That is, if you aren't scared of going on a date with the spider lady. Well then, sweetheart, consider it a date. But first things first, let me take care of you right now. You still need a nurse in this care and a spider's touch. Yes, dear, it's time to relax and let the nurse take care of you. First, I'm gonna wrap your injuries around with my silk, and then I'll soothe your mind so that you can get some much needed rest. All you need to do is relax and let me take care of your beautiful body. That's it. You're doing so good for me, darling. Now I'm going to start with your leg and wrap it with my silk. Make sure it's nice and tight and soft. Just relax as I take care of you. There we go. All wrapped up in a nice cast of silk. Is that too tight for you, dear? Does it hurt? That's good. The cast will help your leg heal much faster now. Just keep it on for about 3 weeks, then it should be good as new. After 3 weeks, come back to see me and I'll take a look. 3 weeks is usually when a patient's injury is perfectly healed. If it isn't, then I'll just wrap another cast with my silk and it should heal better within a week. Alright, sweetie. Can I see that arm now? I also need to bandage it up with my silk. Same thing with your forehead. Don't worry, it won't take that long. There we go. Some soft bandages for those cuts. They didn't look too bad. They were only minor cuts, so it was easy to bandage them up. Oh, you're welcome, cutie. Just a part of the job. And it may not be my #1 favorite, but it's a very close second. What's my favorite part of the job? Well, it's meeting kind, sweet, and beautiful people like you. Oh, there's that blush again. You're too easy to tease, sweetie, but it's the truth. Yes, sweetheart, I do think you're quite attractive and sweet. You've been nothing but kind, accepting me as your nurse. Even if I did give you a little fright at the start. Aw, you have such a cute giggle and adorable smile. Oh, I do hope you get better soon, darling. You promised me a date, and I do plan on going out with you. It's okay now, darling. We can worry about that another time. Right now, you need to get some rest so you can get better soon. You need your strength, and the best way to do that is a nice, deep sleep. Would you like me to stay with you as you fall asleep, darling? I promise to be there by your side until you close those pretty eyes and fall asleep. Alright, cutie. I'll stay here and help you rest if you want. I could make a blanket for you with my silk and tuck you in. Is it okay, sweetheart? Thank you, cutie. I'll make sure to spin the softest and most comfortable blanket for you, dear. That's it, sweetie. All tucked in with my soft silk. The blanket will keep you nice and warm throughout the night and keep you safe. I would love to stay with you if you sleep, cutie. However, I do have other patients to attend to tonight. Don't worry, I won't flirt with them as much as I did with you besides. You're more my type anyway. How about I play with your hair a little bit? Would that help you fall asleep, cutie? Alright, sweetheart. I'll stroke your hair until you fall asleep. Just close your eyes and relax. That's it. Just focus on the feeling of my fingers running through your soft hair. Shh, it's okay, sweetie. Close your eyes and fall asleep, cutie. I promise not to leave you until you are in a deep slumber. Good night, cutie. Rest well and dream of nothing but peace and pure bliss. I can't wait for you to fully recover and Go on a date with me. Sweet dreams, my love. I hope you make a swift and full recovery.